Hello, I'm Matthew Koffenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to continue talking about exercises that can be done in your home. The last two episodes that I have done, we've talked about shoulder exercises that you can do, and we've talked about exercises for your spine to keep your low back mobile and to prevent low back injury. Today we're going to talk about what I consider to be quite possibly the most important exercise that you can do. It's one exercise, should be done every day. And this is for anybody of any age. Very easy to do. There's a very nice progression that you can do with this one exercise, and it will prevent many, many injuries. This is an exercise that is great for the athlete as well as the grandmother. It's a single leg stance. It's designed to improve your balance. It's designed to improve what we call proprioception. Proprioception is your body's ability to know where it is in space. So when we're walking, when we're doing dishes, when we're playing sports, we don't need to look where our feet land. We already know where it's landing, and we know which muscles to contract to be able to do the movement that we want. That's called proprioception. When you do a balance activity, you actually increase that proprioception. When you have greater proprioception, you're going to have less injuries. You're going to reduce the risk of ankle sprains. You're going to reduce the risk of potentially tearing your ACL. And most importantly, you're going to reduce the risk of falling. When we fall, particularly when we're in the 6th, 7th, and 8th decade of life, when we fall, we potentially could break our hip. So we want to do everything we can now to reduce that risk of falling. So we're going to do a single leg stance. So I'm going to talk you through how to start it easy and then how to make it a little more challenging. So the first phase of a single leg stance is you stand behind a solid surface. You could go up to a cupboard. You could stand behind a chair. And what you want to do is you want to place both hands on the back of the chair, and you just want to lift one leg up. And then you stand there, and you want to stand there for 60 seconds. Both hands stay on the chair or the countertop or whatever it is that you're standing behind, and you stand there for 60 seconds. That's stage one. Stage two is you put both hands, stand on one leg, and then take one hand off. And again, you stay there for 60 seconds. You never progress to the next stage until you're comfortable standing for 60 seconds. Once you can stand for 60 seconds, move from stage 1 to stage 2, from stage 2 to stage 3. Never go from stage 3 to stage 4 unless you can do the previous stage for 60 seconds. Stage 1, both hands. Stage 2, one hand. Stage 3 is no hands. Standing on one leg without arm support. Okay. Once you can stand on one leg without arm support for 60 seconds, we then make that even more challenging. We can then move into a stage 4. Again, standing on one leg, and then you can do some head turns. Okay. Again, you do that until you can stand there for 60 seconds. Stage 5, you stand on one leg and you close your eyes. And you try to maintain that for 60 seconds. Stage 6, stand on one leg, eyes closed with head turns. Now we're getting a lot more challenging. So we stand on one leg, we close our eyes, and we turn. And you can see I'm definitely wobbling a lot more. It's much more challenging. So again, use 60 seconds as your guide. Do this every day for both legs. And you'll significantly reduce the risk of falling and any other potential injury. Work through those stages. You'll do very well. Thank you very much. If you have any questions, please contact me at 218-346-2464.
Thank you for watching Wellness for Life.